I'm the founder and owner of Heel Animal Massage. Started that in 2006, and in 2010, I brought on a part-time employee, Beth, who is also trained through the same school that I went through. She's great, fantastic. And just recently, Lori Ness has started up Heel Central Oregon. So that's kind of exciting and scary at the same time, but I have full faith in her. She's also a good friend of mine too, so. And all of that information's on here too. The brochure is a little bit outdated, so if you pick it up and take it with you, just note that this handout this has the most current contact information on it and locations that we work out of. So Heel works closely with every new client's veterinarian. So if you call me and say, hey, I want to get a massage for my dog, I'll get a form filled out, a release form filled out by your vet, just to make sure that we have all the proper history, any kind of pertinent information that comes up for them. And then a lot of specialty vets I'll get information on, work closely with some, PTs. Massage and PT go hand in hand. And any kind of pre-post surgery work. So that it's always nice to kind of get information from the vets as to what's going on or what just happened. So what else? I'm an instructor with the Northwest School of Animal Massage, which is great. Get to travel to Hawaii sometimes, get to travel to Utah. You get to travel a lot too. So I'm sure I'm forgetting something, but I think you're here to kind of learn more about massage and how it relates to you guys working in the field, whether it's at a vet clinic or at a shelter or foster parents or whatever the case may be. So when I was reading through the RSVPs, I think most of you guys were interested in relaxation and calming. And some people had mentioned arthritis too. Massage is great for all of the above plus a whole lot more. And on the handout, the benefits of massage I have listed are pretty, it's pretty short. There's a whole lot more that we could talk about systems and how they benefit, like digestive system, nervous system, musculoskeletal system, and what those specific benefits are, but these are just kind of bullet points that I wanted to point out. So reduces stress and anxiety, that's important. Relieves pain, increases range of motion, strengthens the immune system, enhances the health and nourishment of the skin and coat, and increases healing time. So with the immune system support, the lymphatic system is very superficial, and I won't go too deep on this, but no pun intended. But the immune system is really important, and if you think about the immune system, the first line of defense for that immune system is the skin and the coat. So it is really important to pay attention to the skin and the coat, and that might not seem super important when you're massaging or looking at an animal, but it is really important just to kind of give them that boost if there's any kind of dander, or how does it look? Does it look dry? Does it look kind of crusty? Has it been overwashed? I see sometimes people trying to make their dogs nice and shiny for me every time I come. It's not that important all the time. And then helping the healing time. So I work a lot with pre and post-op dogs and cats, and then also a lot of older animals too. So I work less with stress and anxiety animals, although I will say, going into somebody's house for the first time, they don't know who I am. I'm this new person to them, and I'm palpating them like a vet would do, but I don't have a thermometer. It's all going to be okay. So, just inherently I'm working with stressed animals because they're just getting to know me, and they're uncomfortable a lot of times because they don't know what you're doing. And all of that focused attention can sometimes cause a little bit more uncomfortableness because they're wondering, who you are. So even though my goal might be to work with, that stifle surgery that they just had. We have to go through a whole bunch of introductions and trying to kind of figure out what techniques do they like so that I can really get in there and do more scar tissue work or more massage to reduce inflammation or whatever the case may be. So with a lot of you guys, I think when you're working with animals in that kind of stressful situation maybe, or they're new to your foster home and they're trying to get comfortable, we're going to be using those same techniques. And I outlined some on the second page, but I just want to go through some tips to have a successful session. So some of you guys may not be doing a full massage session with whatever animal you're working with. But if you do end up having a full massage session, some things to, and even if it's like a little 5-minute session, just trying to calm and relax, if you're calm and relaxed, they're going to feel that. So you work in an emergency vet hospital, and there's a lot going on. Dog's been triaged in, you're trying to figure everything out, and you're trying to calm this poor kitty that's needing anesthesia or something like that. So if you can kind of keep yourself in a comfortable position, relax yourself, then the animal's going to feel that. So if you're tight and tense, if you're watching the Seahawks play and they're almost at a touchdown and you're trying to massage your cat at the same time, it's just not, it doesn't go hand in hand. So just make sure that you're comfortable. And if you're standing, simple things like not locking your legs, because that inhibits energy flow and blood flow. So just trying to be conscientious of yourself before working with the animal. I know it sounds simple, but rapid strokes are more stimulating and invigorating. And when your dog sees that squirrel or the other dog and they're dog reactive on leash, and you go down and you say, oh, I have a dog. Just relax, it's okay, it's all right. If you conscientiously slow down your stroke, whatever the stroke may be, I'm using petting or effleurage. If you consciously slow down your stroke, that's going to be better for their nervous system. It sounds simple, but I've been guilty of it too. So the slower strokes are more sedating and relaxing. May not stop them from wanting to eat that squirrel, but it'll help. And just remember to have purpose and focus, because those are key to a successful session, and that you're paying attention to the animal. So dogs and cats, we have a certain sense of touch where, I certainly like it sometimes when my massage therapist puts, her elbow up into my traps and really gets in there and goes deep. With dogs, they have a much higher sense of touch than we do, so they don't need that pressure. Cats, even higher, they don't need an elbow in their rhomboids. So just being aware of very sensitive systems, musculoskeletally and nervous system. Cats are, when we're speaking about humans, dogs and cats are the highest, and then dogs, and then us. It takes a lot to get through our deep tissues, where it doesn't necessarily take as much as you might think with a dog. So if I wanted to get deep into an adductor muscle on the inside of their leg, I would just use compression. I wouldn't get in there with my elbow or get in there with my hand. So just be conscientious of that. And cats have what are called vibrissae, and it's the little whiskers that, and some of you probably know this already, the little whiskers on their mouth, around their chin, they're on the inside of their wrists. So just be careful when you're working around those areas, because they're extra sensitive. They're little areas of super sensitivity to some cats. Other cats, like I have a cat that does so good with range of motion and me doing all sorts of things with him. My other cat is just like, forget that. And it really varies, I've noticed, with cats, but you being somebody new to them, and that it's, certainly with your own cats, it's different, but just sort of being aware that those little areas can be extra sensitive for them. So not just pressure-wise, but also just sensitivity-wise with small little, the air brushes past and they look that way and like smell the air. And so those are some tips to have successful session. And I'll just hop into the first technique. And when I talk about the different strokes, I'll go over them, and then I'll also talk about kind of where on the body would be a good where on the body would be a good area to focus on, and also what the benefits would be in that particular area versus maybe another area. So effleurage is great for dogs and cats and people. This is one that this is a great one for palpating and trying to feel, what do I feel underneath their skin? That's benefit number one to this stroke. And I always tell people, this is kind of, for a whole bunch of different reasons, this is kind of like the golden stroke, because you can glean so much information from this technique. So what you're doing, and it kind of feels like palpation to them sometimes, but you're using a nice gentle hand. You're also checking for, so use a gentle hand. You're using the flat of your hand. And when you run it down their body, before you pick this hand up, you're going to put this hand down. So it might look like petting, but there's a whole lot more to it than that. What I'm doing is I'm feeling, how does that connective tissue, that fascial layer, feel right underneath the skin? Do I feel heat? Do I feel cool? Do I get feedback from the animal that when I go over its hip, do they kind of look at me? And then when I do this, do they still look at me in the same direction with that one hip? Or do they look at me in the other direction, going over that one hip? Maybe both hips are sensitive. So there's a lot of information that you're going to be pulling from effleurage. So that's one thing that, one benefit to using effleurage all over their body. So when I see an animal for the first time, I'll want to go over their body as much as I can for their comfort level and for your comfort level if you're not used to that animal and they're not used to you. Sometimes the comfort level for yourself, make sure that you're safe too. But what do I feel? How does their coat feel? How do they react? How does that fascial layer? So when I talk about the fascia, the connective tissue right under their skin, it's like a spider web. So if I felt that maybe their skin didn't move quite as well over their left hip, then maybe there's a fascial restriction there. And I might want to focus on that, but I'm going to come back to it later because I want to palpate or use effleurage to kind of gather all that information so that I can work in areas of their body that make the most sense and that I can get the most out of that session with. If they're okay with it, pause, go all the way down to their paws. So that's one way to use effleurage. Down the tail. So the other benefit to effleurage, and I will also say too that all of these are Swedish-based massage strokes that you guys are learning today. So there's a whole bunch of other different techniques out there, but these are the ones that I think are most pertinent, and they happen to all be Swedish-based. So when you go get a massage, they'll probably use these techniques on you too. So you can lay there next time and like, oh, that's tapping. So another benefit to effleurage is going to be, so I have this tight area, or I think it's tight. I'm not really sure. There's some sort of tension happening over that left hip. That's where I'm going to use more effleurage in that area to loosen up that superficial adhesion that I'm feeling upon my palpation where I'm using effleurage. So it's going to help with creating heat in an area. So if you have a site of inflammation, would you want to use effleurage a lot? No, because you don't want to create more inflammation in that area. So it's a great technique for if you feel any kind of stagnancy, which just kind of means like, where are your hands drawn to? Does it feel cool? Cool can be a site of stagnancy. It's just not getting proper blood flow to that particular area. And in my mind, I think, why? And then I'd want to, peel back the layers of that onion I kind of look at animals and us too as an onion, where you start doing one technique and you feel something or you get a reaction that you didn't expect maybe, and then you wonder, I wonder what's going on. So then those layers just kind of peel back, and there's a whole lot more to them than what you just see. So you can use effleurage over coolness, stagnation, if they have a lot of dander in an area, as long as it's not really warm. And keep in mind too that, dogs and cats lay in the sun and over heat vents. So I'm not talking about that kind of warm. I'm talking about the kind of warm that doesn't go away. Whatever it is, maybe they're getting more blood flow to that particular area for some reason, working with other areas of the body that may not feel as warm. And then you can take that information to your vet. So that whole process of going all over their body with effleurage, you can keep a little journal and take it to your vet next time you get a checkup, and they're just warm here all the time. And maybe they're not giving you the feedback that it's sensitive, but maybe they are too. And remember too, a lot of animals are pretty stoic, especially if they're in a new situation, they're guarded, they may not show you things right away. So the more you handle them, you're going to be giving them all those benefits from before, supporting their immune system, you're going to be handling them, touching them, they're going to get more comfortable with it eventually. I see it time and time again when we go in for the first appointment, a lot of them are like, "Ooh, who are you?" And then by the third session, it's like, "Ooh, I know who you are." So you're also warming up superficial muscles by using effleurage too. So if I wanted to work with a muscle that was deeper, I wouldn't just go in and start massaging that area. Like if I wanted to work with the triceps, I'm like, oh, those are really tight. I wouldn't just start going in and working. I want to make sure that those muscles are warmed up. I think a good analogy is you don't want to, what is it? See if I can get it right. You want to knock on the door and then have them let you in. You don't want to push the door down when you get there. So if you're going over to a friend's house, if you just push the door down and she's in the middle of doing something that she doesn't want you there right now, you're not going to be invited back. So to be able to knock and then be let in is key. I mean, you can do a lot of damage if you just start working with the tissues, especially if they're really tight or really uncomfortable. So that effleurage is going to be a really nice way to knock on the door, if that makes any sense. So the next technique is tapping, and tapping is a form of tapotement. So maybe you've had it done. I love it. And maybe you've seen it on TV where people are getting a massage and they're getting hacked. This is the lightest form of tapotement that we're going to talk about. So tapping is just using the tips of your fingers, and it's basically like drops of rain, and you can use it or playing a piano or typing on a keyboard, or and you can use it a whole bunch of different ways. So for atrophied muscles or weak muscles, you can use a lot of, and I go back here because most of the time with older animals, there's a lot of hind leg weakness, depending on, and then if you have an animal that's had a stroke or anything like that, where their nerves just aren't firing to specific muscles, you can start tapping on those areas too. And some of you had mentioned arthritis being an issue, so you can also tap, if they're okay with it, over a joint. So if you have elbow arthritis, this doesn't have very good elbows, but what I always recommend when you're working with joints is having that contact on their body. Actually, it doesn't matter if it's on their joints or on their muscles, but having constant contact, that reassurance of having a hand on them somewhere, no matter where it is, wherever their comfort zone is, and then tapping over that joint. And that creates a little bit of vibration and a little bit of circulation through that arthritic joint. So it's a nice kind of easier way, gentler way than maybe range of motion or something like that, which is going to be great for them too. But in this class, and it's also, in this class, it's a good technique to introduce to you guys. And it's also easy on you because it's something that you can do at home with your cats and your dogs. And it's nice and relaxing, usually, unless they're really painful. So, but tapping too, and this is where I am going to jump ahead just a little bit. At the end of this little spiel on techniques, I talk about the cranial and sacral areas, and these are super, super important areas in my opinion. And this is kind of how I assess in the beginning if a dog is really comfortable, if a cat is going to be okay with me to work on them that first time. So animals have a parasympathetic nervous system like we do, and I'm sure you've heard of the fight and flight nerves. These are the parasympathetic nervous system is more of the rest and relaxation nerves. And these hubs for those nerves, so their nervous system runs up and down their spine. Those hubs are going to be right over their sacrum and right at the back of their skull where their skull and their spine meet. So right up in there. These two areas can be accessed and used quite successfully with tapping a lot of times. And so I wanted to bring tapping in and kind of use that craniosacral area there in conjunction with each other. So again, you want to use drops of rain, and it's not like one specific area, it's like a hub. You know, there's an area there over their sacrum. And if you don't know where the sacrum is and all that, we can talk about that later. You guys can come up and ask. But I use this so much when I'm like introducing myself to a dog, meet a dog at a restaurant and they give you their butt. Can do a little bit of this, see how do they react. And same with up here. I will say though too, I find that, maybe you guys can prove me wrong, but more cats like it up here. Dogs do too, and granted my pool is majority dogs, but some of them feel like, you know, they look at you like, what are you trying to do to the back of my head? But you're not tapping hard, it's just a nice light drops of rain sort of tapping. So those are the two hubs that you kind of want to focus on. The other area that I didn't write on here, but I've just found over the years that's non-invasive and a nice area to work with, especially when you're introducing yourself, is the chest. And that can be tapping. I know it sounds like maybe that it's more invigorating or it's actually more sedating and relaxing, because what happens is the nervous system gets used to this incongruent kind of feel of this randomness. I love it, and it's one of those techniques that I use in the car in traffic. I'm like, ooh. I'm sure people are like, what's that lady doing over there? Not at all. But I also had a woman in one of my classes try it on herself, and she said, oh, I don't like that at all. So, and that was such a good realization that, you know, just because I like it doesn't mean the dog's gonna like it, especially in the beginning, or the cat. So try it out. I also had a woman in one of my classes do this on her dog, and that's all, like, I do workshops too. They're an hour and a half long, and you bring your dog to the workshop. And so during this one workshop, her dog was just, you know, looking around at all the other dogs and thinking, what am I doing here? I don't know what I'm doing. But all she could do successfully was just tap her dog's over her dog's sacrum. And he was so happy, and he just sat there. But every time she would try something different, he was just like, what are we doing here? So just kind of all these techniques that we're talking about today, try them out, see how they fit. I promise you, I shouldn't do that, but I'm pretty sure you're going to find one that's going to work for stress and relaxation. So topotement you can use over a joint. You can use just on the chest if they're uncomfortable and you're not sure. You can use it over their sacrum, over their cranial and sacral areas, or all over their body, which feels so good to some dogs, and you can see them like, holy cow. So the next technique is compression. And I should also mention too, all of these strokes can be used, they don't have to be in this order. Effleurage I like to start out with just as a way to kind of feel, like we talked about before, all over their body. What do I feel? What can I write in my notes to check later? And with compression and tapping and effleurage, transitioning from one spot to another spot, like if I was just going to tap up here, I wouldn't pick up my hand and then tap over here. I'd tap here, use effleurage to tap over here. Just trying to keep connected as much as you can the whole time. So effleurage is a nice way to move from area to area. It's a good transition stroke. And compression. So compression is also using the flat of your hand. And you're going to be, it's typically used on bigger parts of the body. So like if you have triceps are a great example. If I've done some effleurage, and even if I haven't done a lot of effleurage in one area, you can still use a little bit of compression as long as it's minimal. You're getting, like we talked about before, dogs have a higher sense of touch than we do. So you don't need to really get in there and get those triceps. You're going to get in there and just easing down, so it's more like just, that much movement. It's not a whole lot. You don't need a whole lot of movement, especially when you're knocking on the door. So go easy, very mild, very mild technique. Again, we can talk about, exactly what that pressure feels like at the end of class. I'm happy to show you guys on your arm. That's what I do in my workshops, just so you get a feel for what that is. And also with cats too, their triceps aren't as big as a pit bull's triceps, so keep that in mind. And also their sense of touch. You just kind of want to go a little bit milder with cats sometimes. I will say, with compression, I've noticed that some cats really, really like compression. And what works for, here's my cat. It's gonna ride the dog. If you have a cat and if you're helping the vet, or if you're helping hold the cat for pills or something like that, cats like burritos sometimes, and it can also just kind of take away that option of spazzing out too. So having a little bit of compression can be really nice on a cat. So I'll just go down their body using super gentle compression. And that can be a nice, calm way to help a cat relax. Tapping is also really nice. So, if you're at home and you have a stressed out kitty cat, you can do tapping on them. A lot of cats really like tapping, and that might seem kind of odd, but again, it's that sedating and relaxing that whole nervous system. So, but compression you're going to get, and cats don't really like their heads handled a whole lot, and part of it is because of all those vibrissae that they have that are pretty central to that, the whiskers around their mouth and nose and chin. But yeah, so compression is just going to look like that down a cat or a chihuahua. And then, you can work on bigger muscle groups with compression with dogs. If I have a dog, that's so funny. I hesitated because most of the time there are dogs around, and whenever I move the dog, I have to be really careful. There are no dogs. So if I have a dog and it's laying down and it's really relaxed, I can work on those triceps, and I would just use gentle compression down the triceps. I can work on their chest. That's another great example. So if you have an animal and you're standing behind it or sitting behind it, You can also go up into their chest and just use your fingertips and use compression on their pectoral muscles. That chest, again, I found that it's just a really nice area to focus on, especially when you're trying to calm and relax. So, use your fingertips, use the flat of your hand. If you're working with the back leg and those big muscle groups, so you've got the hamstrings and the quadriceps. The hamstrings have a little bit more muscle usually than the quadriceps, depending on the dog. But if you're working with a leg, just support it by putting your hand on the inside of the leg and then using compression. And you can go all the way down their leg. I had mentioned that it's good for big muscle groups, but just be conscientious when you're moving down their leg that they don't have big muscle groups all the way down. They have a good calf muscle, gastrocnemius, but lighten up your compression if you're going to go down a little bit less muscle groups. So with compression, you're going to get you're going to be working superficial muscles, and you're also going to be doing a lot of more deep muscle work too. So kind of be conscientious of that also. There's not a whole lot of damage that you can do with compression unless you're just, which I'm not, that's not even an option. So everything that we talked about today with the 3 different techniques and the areas, those are going to be really, I hope, really nice for you to take back and use, practice. So I'll go over the contraindications. If you have an animal with recent strain, sprain, or broken bone, that's vet worthy. Just take them to the vet. No need to massage them. Maybe a little bit to relax them on the way to the vet, but you're not going to fix those, and they're important to get checked out. Any kind of acute inflammation, so soreness, cuts, open wounds, any kind of onset of trauma. Why did they start limping? Why is their elbow inflamed? What's going on there? Best to just take them to the vet. Any fever, shock, enlarged lymph glands. So this one, if you use your effleurage and you think, oh, those mandibular lymph nodes are really kind of big, what I would recommend, and these ones kind of are big, and you can feel your own there too. Some dogs have larger lymph nodes than other dogs. So if you go through your palpation, and I talk about mandibular nodes just because they're more palpable than a lot of the other nodes. You probably won't feel a lot of them unless you're looking for them. But what I would do is just sort of keep that feel, that baseline. How do they feel when I'm using effleurage, going over those nodes, and then, have they enlarged the next week? A lot of times it's just sort of how. I remember sending one of my clients to the vet because I thought, oh, Sammy's lymph nodes are really big, because the other dogs that I had worked on that week, they weren't that big. And so of course, Florence is so dear, and she, oh no. So she took her to the vet, and I said, it could just be an infection in their body. It could be they're fighting a cold. That immune system, that's what it's for. So the lymph glands, the lymph nodes, are part of the lymphatic system. And it filters all the crud that comes through, whether it's anesthesia. A lot of the lymph glands can hold the anesthesia in the system. So, side note, manual lymphatic drainage is a great technique for that. But if it's something bigger and not just anesthesia, and not just, a cold or something, or maybe they have been exposed to, forest fires, all that kind of environmental ick gets stuck in the lymphatic system. So, and effleurage is great for that too. You don't have to know how to do manual lymphatic drainage. But if you find a lymph node that you think, I don't know, that's just kind of big, I don't know what that is, especially when you find one that's bigger than the other, that's when you want to take them to the vet. But I would recommend, poor Florence took her dog to the vet and she's like, oh, she's totally fine, everything's okay. And I thought, okay, that is a really good, it's really good to learn about these things. And I would rather err on the side of, I don't know what this is and I don't diagnose, but I don't know, there's something off here. There's this a little different. I would rather err on the side of caution and letting them go to the vet and check it out. I mean, I've helped diagnose man boobs. That's what one of the saggy chest. So where their muscles just kind of start building up like fatty deposits on their chest. Well, I didn't know that, and I thought, there are some lumps going on up there. I don't know what's happening. And they brought their dog back and said, oh, he just has man boobs. Okay. But again, I would definitely, when you're feeling your animal, what does that baseline feel like? You're using effleurage, you're feeling things. And another thing I'll throw out there too with effleurage and just kind of getting that baseline. When I was in school, I remember there was this woman, she was mostly blind, she had a seeing eye dog, and she felt things that I couldn't feel. And that was such an eye-opener, that, no pun intended. But closing your eyes sometimes can be really nice, especially if you know the animal. If you don't know the animal, I don't recommend that. Please don't. You said. So if you can close your eyes, and you can do it on yourself too, what do you feel? If you take away a sense, the other senses are going to be heightened. So that's another kind of little side note. The other contraindications I have listed are in case of surgery. So, any kind of information that you can get from the vet is really important before you start a massage plan for the animal. And then, of course, if they say no, which I have had, and it's okay. It doesn't mean that you've failed at all. It just means that some animals they just can't let go. And, there are a few cases where, especially if you have people that are like, well, try again. I'm like, I don't think they're having a good time, even after the 6th session. Let's move on. There are other therapies, so many other modalities out there for animals. So I feel like, and Portland is fantastic for that. I mean, just that referral process of, T-touch, acupuncture, hydrotherapy, laser therapy. I mean, it's just like, it's never ending around here, which is fantastic.